got a question for you. I'm just going to be quite honest, be a little bit frank. I'm not trying to be rude or nothing, but I have since I've been dealing with this facility, and I'm not ignorant to how facilities are run. I've been nothing but extremely polite and fair with this facility, and I had a bad feeling about it from the beginning. In fact, within just 2 or 3 days, I phoned Lydia. She told me she was a coordinator, a director. She had a higher up position. Cause see, I was raised by my mother. When people do you wrong, I try to live at peace with people and be passive, but I'm not a pushover. I can be a bulldog, when I have to in the legal system. So what I done exactly? She taught me to go to supervisors, corporate offices if that don't work. But like I said, you try to reason with a person in a business. Nobody should give nobody no hard time for no reason anyway. But then if that don't work, you ask for their supervisor or whoever is a manager or whatever it is. And like I said, I've had to do that several times with this facility already. They're never at their desk on Unit 2. I'm calling now. And in fact, since the beginning, like I said, since the beginning, they've had to go over to the other units and relay messages, which I don't know. I could understand if it was maybe senior citizens and they had to, sit by their bedside or something. But my wife is 29-year-old. I'm just having trouble processing this in my mind, Heather. I don't understand if perhaps the facility's corrupt. I don't understand what's going on. You understand? My wife. Well, it's just, laws are made up for one thing, and nothing against you, but like the kindness, anybody can make their voice sound. Like there's things going on in this facility I don't like, Heather. I'm telling you straight up. I'm not a fool. I've dealt with other facilities in the past. I've been to some myself. I know how facilities operate. They've not given my wife a window of her release, as far as I know yet. I ain't spoke to her this morning, but any facility like 5 days with her, I know her. They're gonna be like, okay, well, we're looking at this day. This is not no state hospital. This hospital, I've never even heard this hospital, but they're acting like. I'm just trying to, So earlier you told me you was gonna relay the message over there. Like I said, I had a problem with adult 2 yesterday. I got through to Miranda, and I told her what I thought about some things, and I was kind and polite as I always am. I just don't put up with corrupt people, and I don't put up with BS. And I didn't like the vibes I got from her. I know how to discern things. I spoke to her, and I try to be cordial. I've been very polite to every staff member down there. It's been yes, ma'am, more polite than I should have. Most people would be. I'll put it that way. But I know how to deal with people, So, anyways, what it is I spoke to somebody earlier, and they said, well, without some something, she said, well, I can't release that. All I can do with a privacy code is tell you if she's here. But see, that's conflicting stories. That's not what I was told from the beginning. They put me on hold and said, okay, she's going to be calling you. So evidently there's a bunch of liars at work down there, because they told me there's some have put me on hold. I'm just telling facts. And if that's offensive, well, I'm sorry. Because sometimes corruption tries to. Okay, well, I appreciate that. And, it seems you're trying to a degree anyway. But here's the thing. See, like, I've never heard of facility, once you get that privacy code, like I don't understand. I understand till you get that privacy code, like any facility can't tell you if that individual's there. But I have my wife's privacy code. It's 2012. And like I said, up to now. Well, how do we get that? How do we get how do we get them? Okay, well, I understand. Every city has its own. I'm not trying to be unreasonable. I understand that. So I'm just wondering, but I don't know if it has been offered to my wife, because she would sign that. I would think, unless you just thought, well, it's not that important right now. It's not significant enough. You know, I'm still talking to him on the phone, but I don't understand why. So anyway, I guess next time I speak to her, I'll see about getting them paper signed. But yes, Heather, if you could relay, I guess, or no, perhaps I'm thinking maybe just there's a lot of patients trying to use the phone right now. I mean, I'm a down to earth person, you know. I'm thinking it's early, maybe several patients are trying to use the phone, you know. But I've been concerned with this medicine, you know, and like I said, so I don't know, but she says she's doing okay on it. This medicine she was on, as I've expressed many times, but she says she's okay on it. So, like I said, that's part of where some of my anxieties came from, Heather. But I appreciate you, and yes, if you would be kind enough to relay, if you think it will help, you know. I don't understand what's going on over there. I don't understand why they don't pick up the phone. It ain't like I've cursed someone or made a threat. I've gotten upset, understandably. Anybody would be in my shoes, because I've been beyond professional and kind. Pardon me? Well, sure, and if that's the case, sure. Absolutely. Absolutely, Heather. If that's the case, I mean, yes, certainly. I mean, you know, if that's the case, certainly. But like I said, I don't understand why they're always away from the desk. I don't understand. You know, here the other day I called and they answered, probably, I mean, they was doing good. They was on the street. They answered most all that day. One day. It's odd. And now it's like they're not answering. So, I don't know.
Well, is there anything else that I can do for you or answer for you?
Well, just as I was saying, if you could relay that message, I suppose. Maybe even ask them to get to the desk, maybe, and put my wife on the phone a minute. I would like to talk to her. It's not a demand or a threat, of course. I would like, if they could, maybe, I know they had the ability to put her on the phone at desk and just cause a shorter time. I do understand, but that would give me some comfort. You know, I'm trying to see, because I think she met with treatment team this morning, or that's what I'm trying to, you know what I'm saying? I'm trying to see if she's met with them and trying to get an update. So.
If she's here, I'll pass along the message.
Okay, and also, yes, if you put me through to like a manager or something, I would appreciate it.
Let me do this right now for you. One moment.
Thank you.
Hello, this is Patricia with Knoxville Center for Behavior Medicine.
What's your name, sir? I can't hear very well. I'm sorry.
No, this is Patricia with Knoxville Center for Behavioral Medicine.
Oh, okay. Well, good morning, Patricia. You sound like your voice or your mouth's away from the phone. Back, I'm having a little difficulty hearing. Make sure it's the connection. Are you a supervisor?
Am I whom, sir?
A supervisor or someone?
I am not.
Well, I don't know. That's like I said, it's like I believe the woman's name was either Nicole or Heather. I spoke to a few people this morning. I've been trying to speak to my wife. She's on adult too, and they're never at the desk. They're never at the desk. Had a problem with Miranda there yesterday, and I don't know. I've had a very unpleasant experience with this facility. You know, as you know, my wife's a patient in there.
Sir, I have a patient with me, so I'm not going to be able to speak to you. I'm not in a position to handle what you're needing. I'm going to send you to the nurse supervisor. Just one moment.
Okay, I appreciate it. They probably won't answer. Knowing that, my nerves are hard to think when you're upset, you know, so.
The person at extension